and we have around 1,958 people here living in this community, and the health center has 4 villages under it. We have Bari, we have Arapi, we have Oyo, and Elegu. When I came here, in fact, we had no power at the facility, and that was one of the issues which was really affecting service delivery here. Like we have several times talked to the district to at least help us and bring the power here. They were really promising us that it is not easy, but they will try. So when people came and really worked on this power, we became so happy. At least it has improved service delivery here. Like those days when they bring a mother for delivery, you as a health worker, you need to bring your own torch from home to come and help them in the night. And when you conduct delivery, of course, you cannot leave your torch here. You need to go with it because you will also be going to use maybe in the quarters. So you leave the patients in darkness because they don't have even a small torch to use.
Oh, makenya ni mudina ndiri. Amevora amejisukiri, amemutiria. Tira matiriri. Naenka. Me naenka diero gara kisa na sisu atini osokoro. Onko amevudi ditiro yolo ama esu bebini adi adimiti adi ki ado yolo yu asa yolo amani yu. Naenka amevudi ngbe amari amani ditiri yu. Aji amadi sangwe atile de asiari emi ongo naivo akodu di ara ameri amatue.
When we used not to have power here, the rate of delivery was a bit low because when these mothers come and if there is no light, we normally refer them to the health center 3. But since now the power is really here, the mothers which are not, those ones who are not high risk and those ones whom we are not able to, those ones who were able to help them here, we normally deliver them here, and at least our delivery has increased.
If COVID is going to be addressed as a global thing using vaccination, then it will be so important that all health facilities within the population access should have capacity to store adequate vaccines for vaccinating the population. The other thing is these health center tools are normally in rural places. Now, because of the rural location of these health centers, it is not easy for them to access grid power, electricity from the main grid, bearing in mind that the northern part and the West Nile part of the country is not well covered with electricity. Despite Moyo has the national grid, but you find out that this national grid is limited to less than 5 kilometer distance along the road where the main line is passing. So it happens that these health centers are really distant from the main town, or the main highway where this power line is passing.
In total, the total catchment population for this health center is 2,079. When this solar was installed, I was even very happy. Like the other money we conducted around 4 deliveries. The solar has helped us a lot.
Yeah, when we are sick, we come here. Recently, I brought a lady who got the accident from the field. We have wild animals here, which usually destroy our crops. The community normally hunt them using these trappers. So he was trapped by these local made trappers for wild animals. And I brought here at around 9 p.m. And we arrived here. We got the security guards around, and he was able to call the in-charge who helped to serve us here with the help of the light. We were satisfied with the services.
Da, hasa barekare njiyo atiko kwenda. Hauna sawa English.
What is the name of your baby? A girl or a boy? How old is he now?
Mbalo.
Oh, wow.
Been advocating through the government, local government. So local government over delayed or because of no funds, then after there, local government now, I think gave that project to an NGO. Now if it reaches to funding the health center, now there we cannot talk much because every financial year there's money which is allocated for every health centers. Now for what part? Because here this health center too, they cannot allocate money to install solar power. They just use it for maybe for repairs and other things like putting up some other broken doors, just like that.
You realize that despite the government, every health center being constructed, there were solar systems installed. But the maintenance of this system was a challenge, not because there is lack of resource. Lack of resource may be there, but when we moved around, do assessment, it's not an issue of lack of resource as such, but the issue is about knowledge. The persons who are at these health centers have not been skilled or equipped with knowledge of how to operate and sustain the system. We have designed the project in a manner that the contractor who is installing the solar system provides user training and also provide posters. Now the health centers we had earlier proposed were actually 7. And we felt those 7 are really in the dying need of this system, of the solar system and the solar vaccine refrigerators. But because also the funding could not cover really all those health centers, so we had to bring the solar system down to 3 health centers, which have more priority, more need than the others. But also that has given us an opportunity when we are done with this process, with this system, then we'll get feedback from GIZ as to how much it costed. And I know over time we will be able to budget for having similar system, the same system in the other health centers.
Like patients can even come, like emergencies can come at night. We can now handle them without any problem. Before that, even our phones used to be off. But these days, you cannot get our phone off because there's power available. 24 hours, we have the power. Charge your phones, charge your radios, even computer. We used to take our computers to town to be charged. And currently, we charge our computer in our office for daily use, which is of great importance. The community is actually so happy because when they realize that there is power here, the service delivery has improved.
Now, these days, as me, like a neighbor, I'm charging my phone here freely. Then the health workers, they used to charge the phones in the center with the money. Now they are charging freely. So I think if they have TV systems, they are going to enjoy it freely.